Welcome to the office. Hi, Flor. How are you? Welcome back.
I'm doing well, thank you.
Okay, so you're coming from Fresno.
Mm-hmm.
We had a few issues going on.
Yeah.
Number one issue was?
Number one was my lower back.
Okay.
And then the pain that I had shooting down from like my right glute all the way to my right ankle.
Okay.
Those are my two huge complaints that I had.
And how are we doing now?
Huge difference, improvement.
Okay.
The right ankle is like very minimal discomfort now.
From our last visit?
Yeah.
We found
Yeah.
something interesting, didn't
Yeah.
we? And I don't know how to explain it, but it showed up. And we were adjusting or trying to get your ankle to release almost 3-4 visits.
Mm-hmm.
And it just wasn't releasing.
Yeah.
And something said to go to that L4 because we know L4 is the nerve that controls tibialis anterior muscle. It goes to the ankle here. And this thing was just so contracted, and even trying to break up that scar tissue wasn't doing it. And as soon as we said L4,
Yeah.
voila!
That's the magic, yeah.
Okay. And then we did coccyx as well
Yeah.
with the sacrum, right?
Right.
Okay. All right, can I watch you walk? Swelling is coming down too. Very nice. Walk 2 times back and forth. You're getting more, it looks like you have more mobility now in that ankle.
Mm-hmm. Yeah.
You're able to toe off a little bit better. You're able to step off of it a little bit better. Excellent. Have a seat over here. You ready for more?
Yeah.
You're going back to work, right?
I start Monday.
You start Monday, and what do you do again?
I'm starting a new job as an OR circulator nurse.
Awesome.
And, yeah, Monday's my first day.
And you're on your feet?
I'll be on my feet. Well, the first few days it's orientation and it's a class, but by the end of the week, I'm pretty sure I'll be in the OR and on my feet.
Very cool. We got to make sure you're mobile, you're able to help efficiently without getting hurt.
Mm-hmm.
Neck is actually clear today. Pretty cool. So what's interesting here, it looks like it's going to break right there under the brow line around T9, T10. There's that L4. How is sitting on the, you're using a donut pillow after that coccyx adjustment, and it's helping you?
It does help my coccyx a lot. I feel just no pain when I'm sitting.
Okay.
But I do feel some, I guess, strain on the lower back. I don't know, maybe I'm not using it correctly or just not used to it.
And I think you're probably not used to it. And we don't want to be using it forever either, you know, that's not the goal. You're going to give it at least a couple months to heal, okay?
Mm-hmm.
Let's go on the other side there. Guess what? Just needs to heal. No more coccyx, okay? Coccyx is good. Today I'm getting L4. 2, 3, 4, 5, 6, 7, 8, 9. That's 10. That's 9. Head down, please. Right there. 1, 2, 3, 4, 5, 6, 7, 8, 9. That's 9. That's 10. 10. 4 and 10 is what we're going to set today. And let me just look at the listing. 4 we're going to set as a PR. We're going to set it as a PRI-ML4, even though it looks like a PRS. And 12, 11, 10, 9 as a PR. PRS. Okay. T10 is also a PRS. Okay. T10 is PRS, L4 is a PRIM. What does all that mean? It just means it's the static listing of the way the vertebrae is misaligned. It's gone posterior, it's gone back, it's turned to the right, and it's on the spinous is on the inferior side of the wedge. So what do we want to do? We want to put it in the exact opposite direction. Okay? You ready for me? Let's go face down. Slide the knees back a little bit, please. Good. Tummy all the way down. Good. Tummy up, tummy down. Tummy up, tummy down. There you go. That's 5, that's 4. So we want to be on the mammillary of L4, and the torque is going to be counterclockwise to close the wedge, and that's the home run. Gotcha. You okay there?
Yeah.
Now let's go ahead and do T10. 2, 7, 8, 9, 10. I'll stay on the right side for this one today. T10. Good. Oh, you're feisty today. Gotcha. Nice. Come up slowly, please. There's my hand. All right, let's walk it out. Spicier than the last visit, or a little less?
Less.
A little less. Good. So your homework is still the same, okay?
Okay.
Just the movement. You have the donut pillow.
Mm-hmm.
Let the coccyx heal. We don't need to mess with it now. It's set. It's good. You'll have some tenderness and soreness as it's healed.
Okay.
Okay? Come back over here and have a seat. So the idea in this work really, and I'm pretty sure you get it, is find the pressure, find the offending vertebrae that's causing the pressure. But it's not the bone that's pinching the nerve, guys. It's the misalignment of the bone that's causing swelling of the disc that's pinching the nerve, or irritating, or swelling, or whatever you want to call it. And if it's the disc that is responsible, aka you want to call it a herniated disc, you can call it a swollen disc, you can call it whatever you want. There's a lot of words used today. And in Gonstead's work, and Gonstead's theory was the disc cannot swell or herniate without first the vertebrae misaligning. And that's a big thing in this work. So we're using the bony levers of the vertebrae to reposition it back onto the nucleus. That's why the adjustments set deeper and there's less crackling when we're getting the disc set. Does that make sense, Flor?
Mm-hmm.
She still has a little heat, but no break. I think I want to set it a little bit more. You feel that?
It's a little tender.
There's still a tiny bit.
little, yeah.
Can we go back over there and finish it up? You gonna give it? Come on, you can do it. I know you can. And that's the thing, right? So we talk a lot about herniated discs. And, it's a big thing. And the idea is you can have, let's set this first. I'll save it for a class. 5, 4. Tummy down. Knees back a tad, knees back, knees back, knees back. Tummy down. There you go. That's not it. Still, you're fighting. Let it down. That's a piece. Come up slowly. I'm still not happy with it. Come over here, please. I can't let you go back to Fresno like that. I gotta get it. Why I'm choosing to go to this table, she's blocking it at the very end because she knows what's gonna happen. She knows she's gonna feel really good when we get it. There we go. There we go. Poquito. There's the rest. Okay? Let's work it on. Is it as brutal as it looks?
No.
It's not, right? Walk, please. She's not limping on that ankle either. Come back over here and have a seat. And let's reach it. There you go. I can already see it. Yeah. Sacrum. Good?
Yeah.
5,
No pain?
4.
No pain?
There you go.
Nothing?
Nice. Let's go on your back over here and let's check that ankle. So what we're looking at is not my ankle hurts. So I'm looking at, do we have equal dorsiflexion of the ankles? Now slide down so your ankles are hanging off the edge. There you go. Perfect. And let's take a look and see here. Heels together. Bring your feet, your toes back as far as you can. Keep going. And what's interesting now is the right one goes back further than the left.
I feel it.
You feel that? And you came for your right ankle. And I'm pushing. Tender.
A little bit. But
More here.
yeah.
So now I gotta work on your right one. Uh-huh. All right. Let's see if we can just get a quick set on it. Nope. Can't do it. Slide up. I'm actually not touching your right ankle today. I'm gonna do your left one today. AS talus, medial tilt. There you go. Bring the toes back. There you go. You're all set. Walk it off one last time. And then I just want to buff out that L4 a little bit for you. You're going to walk at least 15-20 minutes before you leave. All right. Good times. You ready to go back to work?
Yeah, I'm ready. But it's been a nice vacation, so.
You've had you time now, right?
Yeah. A lot of
You got,
healing and
you got to work on the body, the mind, the soul, everything. And it's not easy. I appreciate you because I'm also the patient who travels to get adjusted. And it's a big deal. You're driving 5 hours, right? 5.5 hours?
So it's 3.5.
Oh, 3.5. Sorry, you're driving. It's only 3.5 hours?
Mm-hmm.
Oh, wow. I'm thinking San Fran.
Yeah, that would be more like
That's
5.
5.5. Still 3.5 hours is a drive. Five, 4, 3, 2, 1. So I appreciate you coming down. We'll have a follow-up. I would 3 to 4 weeks.
Okay.
Okay.
Mm-hmm.
On a weekend will work. I'll be open on the weekends.
Okay, that works.
Just check with Shasha the schedule, okay?
Mm-hmm.
Come over here, please. Right. Squeeze. Hand is good. Find it, accept it, fix it, leave it alone. Questions, comments?
No questions at the moment. Thank you so much.
You're welcome.